We will be right here every day at 1 o'clock to make sure that everybody is well informed and has the best facts as possible so that we can all keep ourselves safe and healthy as we deal with the coronavirus. As you can see from the data displayed on your screens, or will be displayed in a second, the cases in Rhode Island and unfortunately the deaths in Rhode Island and hospitalizations continue to rise. Although that is sad, I don't want folks to panic. It's consistent with what we have expected, and it's why I'm giving you the advice that I'm giving you. I wish we were out of the woods. We are not quite out of the woods yet, and so that means the stay-at-home order, which is in place until May 8th, is something that we all need to continue to obey. I know if your family is anything like my family, it's getting harder every day. We're all sick of it. We all wonder, is it necessary? Wearing a mask makes it even more difficult. But the answers are, it is necessary. It's a critical 2 weeks ahead. And if we keep doing the great job we're doing, we are going to be in much better shape in 2 weeks than we are today. And that much closer to going back to work, opening child care centers, opening parks, and getting to the business of life again that we all want to be doing. So I would just ask you to continue your heroism, all of you. If you're a healthcare worker, you're a hero. If you're one of us that goes to work every day, thank you. But frankly, if you're just staying home, even though it's hard, keeping yourself isolated, even though it's hard, you're a hero too. You are the reason, actually, that we're doing as well as we are doing, that our hospitals aren't full, that we don't have more fatalities than we do. So thank you. It's brutal, but you're doing it. I'm proud of you, and thank you. I have been asked every day, where's the model, Governor? What does our model look like? Where are we on this disease? What's the track, et cetera? So I thought today I would give you a little bit of an update on our modeling effort, on our modeling team, and give you my best insights as to where I think we are, where I think we might be going. So for the past 6 weeks, we've been hard at work trying to gather data, review the science, talk to experts, and do our very best as a team to make sure we're doing the best job we can for you. So I have put together a team. As I said, I have 10 work streams. One of the work streams is modeling. All they do all day is look at the numbers. It has about a dozen people on it. It includes economists, epidemiologists, toxicologists, data scientists, computer scientists, analysts, and computer coders. It's been a collaborative effort with the Department of Health, our own experts, Brown University, and Brown University's Policy Lab. By the way, I want to give a huge shout-out of thanks to Brown University. I called you over a month ago, and you gave us your very best statisticians and public health experts and epidemiologists. Thank you for being a great partner. We are using, there are a lot of models out there. You've seen them all. By the way, none of them is perfect. We are basing our model off of a framework that's been provided to us from Johns Hopkins University. We reached out to Johns Hopkins several weeks ago, and we've been validating our work with some of the experts at Johns Hopkins. That team of people that I just described, our dozen people, plus Johns Hopkins, has also been consulting with their counterparts at the University of Washington. And together they've crafted a model that reflects where we think we are at this time. It is a combination of what we know about the virus from other countries and other communities that are ahead of us, and also the actual Rhode Island experience. It's very important. Every state's different. Every state's done social distancing differently. And so our model includes data around what's actually happening in our community. Now, as you know, I have been reluctant to share a model, and some of you have been critical of that decision. The reason I've been reluctant is because it's not a perfect model. I don't want anybody to look at any model and think it's perfect. It is not a perfect predictor of where we're going. It's not a perfect predictor for a few reasons. First of all, to get any one of these lines, the statisticians do thousands of simulations, and then it's their best estimate, their best guess of which one of those thousands of lines they think is most accurate. So it's imprecise. Secondly, we've only been at this for a few weeks, really. And here in Rhode Island in particular, the numbers of people in the hospital on ventilators who have unfortunately passed away are actually very, very small. So I have been reluctant to share something that is imprecise. Having said that, we have been working hard at it. It is now in a place where I feel comfortable to put something out to the public to give you a sense of kind of where we are and where we might be going. Again, I want to say this. The single most important variable in the model is the degree of effectiveness of social distancing. Hard thing to measure, by the way, but that is what drives the model the most, any model that you're seeing out there. Here in Rhode Island, I put the social distancing, the stay-at-home order in place just a couple of weeks ago. Any expert will tell you it takes at least 10 days from the time you put that in place to start seeing the effects of that on our hospitalization rate. And our model is pegged to hospitalization rate, which means in the model that I think is on the screen or will be on the screen in a second, we only have like a few days of hospitalization data from the point in time that our social distancing has really been effective. So I do want to caution around that. So having said that, if this is directionally correct, we've been at it for 6 weeks, we have dozens of people around it, we're talking to everyone we know, this is directionally correct. So what you see on the screen are two lines. There's a blue line. The blue line you can think of as our best guess of what we think the next few weeks will look like in Rhode Island. The blue line assumes all of the current restrictions, the stay-at-home order, the mask wearing, the social distancing, are in place, and we're doing a pretty good job of adhering to that. Not a perfect job, but a good job of adhering to social distancing. In that scenario, we think our peak will be around May 3rd. That means, last week of April, first week of May, approximately. And at that time, we'll need about 2,250 hospital beds. So, a couple points. That number of hospital beds is a number that we could handle within our existing healthcare system. Every hospital has been working with us furiously to put in place their surge capacity plans within their hospital. And the 2250 would allow us to hospitalize everyone at that peak in our existing hospitals without having to go to the overflow hospitals that we are simultaneously building at the Convention Center and in Cranston. It will be difficult. It will be very difficult. Probably the hospital administrators are getting a little nervous because they're going to have to execute their surge plans, but it is possible. Above that line on your screen, you should be seeing a red line. That red line represents what we think will happen if we stop taking social distancing seriously. And in that scenario, the peak comes sooner, probably closer to April 27th, and obviously the peak is much higher. In that scenario, in the red line that you're seeing, we'll need closer to 4,300 hospital beds. We are working hard to make sure that we would have that many beds. We're not quite there yet, but I want to say this. I don't think we're going to be there. If you say to me, Governor, do you think we're going to be the blue line or the red line? I don't think we're going to be the red line. I don't think that because you're doing an awesome job with social distancing. But you need to know this. The biggest difference between the blue line and the red line is the degree to which we obey the social distancing stay-at-home order. So for those of you who wonder, does it really matter? It really matters. We're talking double the number of deaths, double the number of hospital beds, determined by what we do together as a community right now in the next couple of weeks. My mantra from day one in managing this crisis and motivating my team has been that we will prepare for the worst and work for the best. So I want you to know, Rhode Island, that's what we've done, and because of it, we're in pretty good shape. We've been preparing for the worst. If we need to, we will be ready with over 3,500 hospital beds in the next few weeks. But because we've all been working our tails off, including you and those of you who are staying at home, teaching your kids at home, struggling through this, wearing your mask, washing your hands, because of you, I don't think we're going to see that red line. Now let me tell you this. A week ago, that red line looked a lot worse. A week ago, or 10 days ago, when we were crunching through the model, that peak was a lot higher. And that, I no longer worry about that anymore. I am no longer worried about what I was a week ago, which is 6,000 or 7,000 people in the hospital. Now I think that top bound of 4,300 beds, that could happen. I'm not going to lie to you. That could absolutely happen. If everybody on a beautiful day goes to the park, if we all start getting a little lazy, going out, congregating, then we'll look like the red line. However, if we keep doing what we're doing, stay at home, washing our hands, working from home, I actually think our actual experience will be even better than the blue line. And so that's what I'm working for. I'm preparing for the worst, but I am working to beat that blue line, and I want you to do that with me. Because if you do, we can all go back to work sooner, we can go back to school sooner, we can breathe a sigh of relief, and we don't have to begin these press conferences every day with horrible numbers of people sick in the hospital and dying. So I hope in a couple of weeks I could come back to you with a different set of lines and say, way to go, Rhode Island. We're below that blue line, our system is not overwhelmed, and we see real light at the end of the tunnel. But I wanted you to see that your hard work is already paying off hugely. Now, for some of you, my family and friends make fun of me because they say I'm a data geek. I have a lot of degrees, and one of them is in economics, so I kind of get into the numbers. But if you're not interested in the numbers, you're not a data geek, you're saying, what does this all mean for me? Let me tell you what I think it means for you. First of all, I think we're doing well. I think we're doing very well. I think we clamped down quickly. I think we did it in a smart, targeted way. And as a result, we're in a better shape than we would have been. And again, 10 days ago, that model, the red line, was a much higher number. And I think our actual experience 2 weeks from now is going to be better than the blue line if you all keep doing the hard work of staying at home. Sounds easy. All you have to do is stay at home. It is really hard. Secondly, the peak is a few weeks away. I am not going to pretend that I know it's precisely on May 3rd or April 27th. But I know it's not behind us, and I know it's kind of end of April, early May. It also means these are very preliminary data. Again, our model is based off of hospitalization rates. By the way, why have we done that versus, say, infection rate? Because we know with certainty how many people are in the hospital. We know that. We don't really know the infection rate because we don't really know exactly how many people have this. We definitely know how many people are in the hospital. But we have very limited data on what the hospitalization rate is like since we put in the stay-at-home order. So although that is that's like the Mercedes-Benz of models, we've put so much effort into it and so many brilliant people around it, it's only as good as the assumptions and the data. And we have limited data. And again, the final key point is the single biggest variable is the effectiveness of social distancing. That's not all that matters, but that's the biggest variable. So the real takeaway, if you remember nothing else from today, social distancing is working, social distancing is saving lives, and if you hang in there for a couple more weeks, we will be in a much, much, much better place because of social distancing, because of all your effort. I think of what we're doing here as a race, right? So when I say we're planning for the worst and working for the best, it's a race. We're in a race against this virus, a race to put a lid on the virus while we're racing as hard as we can to ready our healthcare system for a surge. And the race that we've been running is getting up testing capacity, purchasing PPE, buying ventilators, adding extra hospital beds, getting folks to figuring out ways to staff these extra hospitals. That's the race we've been running. And I will tell you, when we start to reopen the economy, you're going to see those numbers go up. It's going to happen. Social distancing is what's saving us. That can't be that way forever. But when we start to reopen, and if the numbers go up, we have the hospital beds, we have the testing, we have a lot more information, we're that much closer to treatment, we have more PPE, et cetera, et cetera. So to that point, I want to wrap up this by saying, if you are a healthcare professional who is not working full-time, if you're a part-time worker, a recent graduate, a soon-to-graduate nursing school, a resident, a medical student, a retired physician, a retired therapist, a retired nurse, please go to riresponds.org and sign up and let us know you're willing to help, because it is almost certain that we're going to need extra people to staff beds as we go in the months to come. So that's what we have for modeling, and in a couple of weeks I'll provide another update. Next topic is school. Many of you are probably wondering what's going on with school, and I had hoped to be able to make an announcement this week. You do know, or I will remind you, that we've committed to distance learning through the end of April. I had hoped to be able to make an announcement this week giving guidance for the rest of the school year. But I'm going to hold off on that until probably next week. And I'm sorry that that's frustrating, because I know everybody wants to plan. But I'm going to be very honest with you. This is a huge decision. This is a huge decision. Not only are we talking about 142,000 school kids and all of the teachers and custodians and folks that work in the buildings, but it's also childcare. You know, it's very, very difficult for people to work if schools are closed, particularly for young children, and they don't have childcare. So it weighs on me, and I want to get it right, or I want to do the best job I can to get it right. This model shows, and I track it constantly every day, things are changing. As I said, we're in a much better position today than we were a week ago. If everyone keeps doing a great job, I think we'll be in a better position in a week than we are now, and 2 weeks than we are now. So I wish I had an answer today. I'm sorry if that's frustrating for educators and parents, but I need a little more time to look at the evidence, to look at the facts. I am not willing to throw in the towel yet and say school's out for the rest of the year. I'm just not there yet. I don't know that that will be necessary, and I don't know that that's the right thing to do for Rhode Island, for all of Rhode Islanders, parents, kids, educators. So I'm going to hold steady right now for where we are, distance learning till the end of April. I'll be back next week with more guidance, because I'm not, as I say, I'm not ready to throw in the towel. I will say this. I get daily reports on distance learning, and you're doing a fantastic job. I've been talking to principals, educators. I had a call with superintendents, parents. I've been talking to parents. This isn't easy. I'm not going to pretend it's easy. There are many, many parents who are working from home and trying to educate their kids or help them get educated at home. Thank you. You are really heroes out there. Teachers are stretching the limits of their creativity. Same with principals and superintendents. But the fact is you're doing a fantastic job. Attendance rates are up, engagement rates are up, and children are learning. Right now, there's nearly a dozen states who have said no school for the rest of the year. There are many states that haven't even tried with distance learning. You're doing it, and you're doing a heck of a good job, and I'm incredibly proud of you. You deserve more guidance. You deserve an opportunity to plan for the long run, and I'm asking you for another week or so before I can give you that guidance. One of the obviously most horrible parts about dealing with this virus is that too many people are out of work. It was a necessary response, and one that is taking a toll on Americans all across the country. Here in Rhode Island, that is also true. We have about 160,000 Rhode Islanders who have filed for unemployment since this began. And to those of you, and there are many of you, who are struggling financially, I want you to know we are doing everything we know how to do, everything we can do, to support you financially. And we're going to continue to come up with additional ways to help you. More loan programs for small businesses, more tech support for small businesses, better benefits for folks, or quicker access to benefits for folks who are unemployed. For those of you who still have your jobs, I need you to be brave. I need you to be brave and go. If you have to go to work, go to work. I'm not saying it's easy. I know you're nervous. I know you're anxious. If you're a healthcare worker, that is triply so. But we need to be brave together. And if you are on the front lines, or you're one of us who goes to work, people are relying on you, and I need you to continue to go to work. And we need to continue to work hard to make sure, if you are in the healthcare field, you have the proper protections that you need so that you can be safe. Even though we have 160,000 people out of work, there are many companies who are, believe it or not, struggling to find employees. And a lot of that is because people are afraid to go to work, which is why I'm asking you to be brave. Right now, there are nearly 2,000 openings in Rhode Island for jobs that are critical in our fight against the virus. Healthcare jobs, grocery store jobs, pharmacy jobs, manufacturing jobs, and more. So in an effort to match up some of the people who are unemployed with the 2,000 job openings, we've created a partnership between the Department of Labor and Training and Skills for Rhode Island's Future and the Commerce Department. And as of today, we've launched a state job-seeking platform to help connect Rhode Islanders with these positions. So as of today, if you're looking for a job, or if you're an employer struggling to fill your open positions, I want you to go to employri.org. Employri.org. if you're looking for a job, check it out, employri.org. They're hiring immediately. If you're a manufacturer or a company that's struggling, you also can go there, and it's a matching function. We want to do everything we can to make sure anyone who wants to work can work, and for those of you who are trying to keep your businesses afloat, I know it's a really tough time to hire folks, so we're going to do everything we can to help you.